Take for example the disorder called anorgasmia. Anorgasmia is a condition that can affect men or women, where despite adequate stimulation and arousal, a person is incapable of reaching orgasm. This can happen to anyone from time to time. Perhaps they're too stressed from work, or are experiencing an unfortunate side effect from medication. But it doesn't mean that there's something wrong with them at this point. However, it is possible that not being able to orgasm will cause that person to worry if there is something wrong with them, creating sexual anxiety. Then the next time that they have sex, that anxiety will prevent them from reaching climax yet again, which will only make their sexual anxiety worse. It is possible for a vicious cycle, such as this one, to go on indefinitely, forcing the sufferer to seek professional help. When faced with trying to diagnose a sexual dysfunction, a doctor will first try and determine the root of the problem. Is it the result of a biological issue, such as diabetes or hypertension, a psychological issue, such as stress or depression, or is it due to interpersonal issues in that person's life, such as marital problems or religious conflict? For now, I want to focus solely on the psychological aspect of sexual dysfunctions. There are 9 distinct sexual dysfunctions recognized by the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, version 4. These 9 dysfunctions generally fall into 4 distinct categories: disorders of desire, disorders of excitement or arousal, disorders of the orgasm phase, and sexual pain disorders. There are 2 other sexual disorders also recognized by the American Psychiatric Association that are very controversial, as many people do not feel that they should be counted as disorders. I'll talk more about those later. There are 2 dysfunctions recognized by the American Psychiatric Association that fall under the category of desire disorders: hypoactive sexual desire disorder and sexual aversion. Hypoactive sexual desire disorder, or HSDD, is a condition marked by a lack of interest in sexual activity over an extended period of time. That period of time can be anywhere from a few weeks to a person's entire life, depending on the root cause of their HSDD. To be considered a disorder, and not just a typical periodic dip in libido, the condition must be causing the person distress or interpersonal difficulties, and may not be accounted for by another mental disorder, drug usage, or some other medical condition. It's not that people with this condition dislike the thought of sex necessarily, it's that they find themselves increasingly uninterested in sexual activity for an unusual period of time. In that way, hypoactive sexual desire disorder should not be confused with sexual aversion disorder. Whereas HSDD is characterized by a lack of interest, sexual aversion disorder is an outright phobic aversion to sex. The sufferer will usually have feelings of fear, revulsion, or disgust at the very idea of sexual intercourse. The degree to which a person is overcome by these emotions, and to what specific stimuli they respond, varies greatly. Sometimes this condition can be so bad that even kissing, hugging, or other acts of affection will trigger these negative feelings. Sexual aversion disorder can be a lifelong affliction, in which the person has never found sex appealing, or can occur in response to traumatic experiences, such as rape or sexual abuse. The next category of dysfunctions are disorders of excitement or arousal. The stage of arousal is when your body undergoes physical preparation in anticipation of intercourse and the accompanying sense of sexual pleasure. In men, this takes the form of an erection; in women, a lubricating plasma that seeps through the capillary walls in the vagina. Arousal can occur by 2 methods. The first is called reflex arousal, and that is when your genitals get stimulated from physical touch. The other is called psychogenic arousal, in which thoughts, images, or even scents lead to physical arousal. Let me demonstrate how psychogenic arousal works. Here you have a person's brain thinking about whatever dull daily task brains think about: taxes, work, regulating your autonomic nervous system. And here you have a person's sexual organs during that same boring monotony. They're not doing much at all. Now, when you introduce something sexually stimulating to the brain, it sends the message to your genitals that, hey, we might be having sex, get ready. Your genitals will then respond in a manner according to your gender, and hopefully a good time will be had by all. Now then, same scenario. You introduce a sexual stimuli to your brain gets aroused, brain sends message to your genitals to prepare for imminent sex. But here's where things go wrong in people who suffer from an arousal disorder. Rather than preparing themselves for sexual activity, the genitals just ignore the message altogether. This inability to physically respond to sexual stimuli is the defining characteristic of arousal disorders. There are 2 such dysfunctions recognized by the American Psychiatric Association. One is exclusive to men and is called erectile dysfunction. The other affects women and is called female sexual arousal disorder. Even with the physical differences between men and women, these two problems are very much alike and will often share similar causes. Sex happens best when we are in a relaxed state, so conditions such as stress, anxiety, guilt, and depression are all problems that can contribute to these disorders. Stress alone is responsible for as many as 20% of the reported cases of erectile dysfunction. But how exactly does stress hamper a man's physical readiness for sex? The answer lies in the autonomic nervous system. This system controls functions of your body that you don't consciously think about: breathing, the beating of your heart, pupil dilation, and so on. The autonomic nervous system is further divided into two subcategories: the sympathetic nervous system and the parasympathetic nervous system. Your sympathetic nervous system is what controls the classic fight or flight responses. It will speed your breathing, increase your heart rate, and boost your blood pressure. It also mediates sexual arousal. By contrast, your parasympathetic nervous system is what slows your heart rate and breathing when you are in a relaxed state. Both of these systems are required for normal male sexual response. Let's look at a demonstration of how the two work together during sex. Here's a normal, unaroused man's nervous system. Notice that the majority of the neural input at this time is from the sympathetic nervous system. As he begins to get aroused, the parasympathetic nervous system takes over, allowing blood to flow to the spongy tissues of the penis so that they fill up, thus causing an erection. When sexual activity begins, the sympathetic nervous system comes back into play. As sexual stimulation increases, so does activation of the sympathetic nervous system. Once the sympathetics reach the height of stimulation, ejaculation occurs. The parasympathetics are inhibited, and within a short period of time, the erection fades. But when a person is under a lot of stress, their sympathetic nervous system is in overdrive. They can't establish enough parasympathetic input to the penis to allow the blood flow needed to achieve an erection. Women's genitals also require increased blood flow to function properly during sex, so stress or anxiety can be a cause of female sexual arousal disorder as well. As an interesting side note to this chapter, serotonin uptake inhibitors found in antidepressant medications frequently cause arousal disorders in people as well. So depression can cause erectile dysfunction, and the medication to treat depression can also cause erectile dysfunction. It just seems that some people can't win,